Our top story this half hour, the latest on a huge new hack attack. We learned this week that hackers had raided the computer systems at Anthem, the nation's second largest health insurer.
They may have gotten away with as many as 80 million medical records. The attack comes at a bad time. The entire U.S. health industry is shifting from paper to digital record keeping. Kris Van Cleave has more.
Digitized health files are jet fuel for medical identity theft.
Pam Dixon researches medical data breaches for the World Privacy Forum. She's concerned the federal government's $26 billion investment in electronic health records is not secure.
The healthcare system built a digital record system without building the corresponding privacy and security safeguards.
Federal law requires medical providers to protect patient data, but the Department of Health and Human Services admits to date it has audited only 115 healthcare providers out of an estimated 700,000. This, as a recent survey of healthcare professionals found, 45% fear their organizations have not properly implemented security measures. And healthcare data breaches continue to rise, from 102 in 2011 to 333 last year, prompting the FBI to issue 2 warnings to the healthcare industry.
There's a sense that a medical record has value, that it can be sold for sometimes 50 or 100 times more than credit card data, so that organized criminals are attacking healthcare institutions.
Dr. John Halamka is the Chief Technology Officer at Beth Israel Deaconess Medical Center in Boston. They have increased their spending on security after a breach 2 years ago.
If data is lost here, it's recovered here.
He showed us one of his highly secure data centers.
Although more dollars are being spent on security, it is true that in general, healthcare has underinvested in IT as an industry.
Does that potentially make people's medical records vulnerable?
The medical industry has catch-up to do.
We've also found when the federal government does take action against a provider with weak cybersecurity, it's often after a breach. Health and Human Services tells us they've reached 14 settlements with providers for $15.4 million. For CBS This Morning Saturday, Kris Van Cleave, New York.